Hello viewers, I am Dr. Devesh Gupta, Senior Professor and Head, Radiological Physics, Dr. Sampurnanand Medical College, Jodhpur, Rajasthan. Today I will be talking on radiation physics basically, and my module 30 is heading Introduction to Brachytherapy in the Treatment of Cancer. Brachytherapy is very useful mode of treatment of the cancer. There are basically two types of therapy, radiotherapy. One is teletherapy, where radioactive source is at some distance, and second is brachytherapy, where radioactive source is very close or in contact with the body. Brachy literal meaning is very close or inside body. Today I will be discussing this brachytherapy. There are various types of brachytherapies which we will discuss during the course of this presentation. Our objective of today's is brachytherapy in the treatment of cancer, and in objective first is introduction about brachytherapy, brachytherapy techniques, new developments in brachytherapy, and in the end I will summarize the brachytherapy. In the introduction, external beam radiotherapy, where source of radiation is outside body and it at some distance. The distance generally is 80 centimeter to 100 centimeter. In teletherapy machines, most of the teletherapy machine where cobalt-60 source, radioactive source is used, the distance from source to patient is approximately 80 centimeter. And in linear accelerator, where high energy photons are used, in that case the distance of the source to skin is 100 centimeter. In brachytherapy, source is very near or on the surface or inside body. Brachytherapy means short distance, discrete sources, close proximity, rapid dose fall off. The advantage of brachytherapy here is the dose which is delivered is very high in the vicinity of the source, and the dose fall off very rapidly with distance. Second classification on the basis of application, where in some cases intracavitary therapy and intraluminal therapy are used, interstitial therapy is used, and surface mold therapy is also very useful in this case. Intracavitary therapy, where an inside body source is placed, intraluminal like in esophagus. Intracavitary example is CA cervix. Interstitial therapy is used in the cases of soft tissues, breast cases, etc. And all surface cancer cases are treated by using mold, and they are placed on the surface and dose is delivered on the surface. Now further classification of brachytherapy is on the basis of source loading. In olden days it is preloading. Applicator is preloaded and contains radioactive sources at the time of placement into the patient. In this case, the person who is loading the radioactive sources will get very high doses, and nowadays it is not used in practice. Second is after loading system, where applicator is placed first into the target position and the radioactive sources are loaded later, either by hand, that is called manual afterloading, or by the machine with the help of software, that is called remote afterloading. Manual afterloading were generally used in olden days where the sources are placed manually, and the person who generally does this job will get very high dose. Now this manual system is also discarded, and afterloading system, remote afterloading system is now used. Now it is further classified on the basis of dose rate. LDR, that is low dose rate, where the dose rate is 0.4 to 2 gray per hour. This dose rate is very low. Second is medium dose rate, MDR, where the dose rate is 2 to 12 gray per hour. Third, which is very popular nowadays, is high dose rate, where the dose rate is more than 12 gray per hour. Practically much higher dose rates are used. On the basis of the treatment time, also this brachytherapy is classified. One is temporary, second is permanent. Advantages and limitations of the brachytherapy is localized high dose to the tumor volume. Since the radioactive source is placed very close to the tumor, the doses to the tumor region or tumor volume is very high. And in brachytherapy, the doses are very sharply reduces with distance. So this is the advantage, that distant organ will get very low doses. Since we can deliver very high doses to the tumor, its results are excellent. Very good results, it shows very good results. Combination of external and brachytherapy, most of the cases where external beam therapy is also used, followed by brachytherapy. The limitations of brachytherapy are accessibility of tumor volume and its size, because in the body various positions are there where tumor can have, and it cannot be from externally, we cannot reach to that position, and if we cannot reach to that position, we cannot apply brachytherapy to those areas. That is the biggest and the only one limitations is there. But it is overcome by using very small sources. Size of the source is very small, and very small applicators. Now second limitation is, if the lesion is too big, too many radioactive focals are required. If the tumor is big, then we have to adjust the applicator in such a way that source positions would be many, and there will be a treatment time will be very high in that case. Next is high risk of exposure during preparation and application of the sources. During preparation of the sources, there is a chances of high doses to the persons, but that limitations is overcome by remote afterloading system. Source reconstruction and dosimetry are laborious. The most important part in brachytherapy is to plan the case accurately. If the planning is not proper, dose delivered to the tumor will be different. It may be very high, it may be very less. If it is very high dose to the tumor and the surrounding regions, there will be radiation effects in the body. And if it is less dose to the volume, then there is no advantage of delivering radiation doses. Patient will not survive in that case. Tumor will not regress as expected, and disease will reoccur. And once the disease is reoccur, it is very difficult to treat the patient once the disease is reoccurred. Now the radionuclides which are used in brachytherapy, they must have some properties. We generally use gamma ray emission, the radionuclides which emits gamma rays from energy 0.2 to 0.4 MeV, monoenergetic energies. Half-life should be such that correction for decay during treatment is minimal. For permanent stock, long life, half-life is desirable. Short half-life sources used for permanent implants. Now, if half-life is very short, then we have to replace source very frequency, and during treatment also the correction is required. So the sources which are used should have sufficient half-life, a long half-life, so it can be used properly. Its calculation is much better. Planning can be done in a proper way. Charged particle emission, absence of or of very low energy which can easily be filtered. There should be only gamma rays which should be emitted. There is no source which only emit gamma. There must be some other charged particle, either beta or alpha, will emit from the radioactive source. But the energy of these charged particles should be such that it is absorbed in the source itself or in its capsule where the source is enclosed. So it should be absorbed there, and only gamma energy which is coming out is useful for the treatment. No gaseous disintegration product. There is no byproduct of any gas, because in older days radium needles were used. Its byproduct was radon gas, and radon is very dangerous in the sense it is again a radioactive, and once if somebody inhales that radon, this radon is alpha emitter. It will go inside the lungs and deposit in the lung and will go on delivering dose to lungs, which ultimately produce fibrosis in the lungs. So such type of material or radioactive substance should not be used in the treatment of the cancer patients. High specific activity. The material or the radioactive substance which is used should have high specific activity, means a small quantity of the material should deliver high radiation doses. If it is high specific activity is high, then small sources can be made, and if the sources size is small, it can be used at the various places in the body. Different type of tumors can be easily treated. Applicator size will be small in that case, and we can conveniently use that source. Non-toxic and insoluble form, and should not powder or disperse if damaged. The radioactive source should not be toxic, and it should be insoluble in the form, should not in the powder form. If it is damaged, then if it is in the powder form, this powder will come out and spread in the vicinity, and there will be contamination, radioactive contamination in that area. So such type of sources should not be used in brachytherapy. Different sizes and shapes. The source which are used can be made of different size and different shapes. Cost and availability. The material which is used for brachytherapy should not be very high, very costly, and should be easily available so that its use is viable and convenient. Now, the type of brachytherapy is, one of the type is intraluminal. We can see the images here. This is a case of esophagus, CA esophagus, and we have inserted the applicator inside, and different positions source are placed. This case is treated with the help of high dose rate brachytherapy machine, where the source used is cobalt 60, and at different places source is only one, different places it will stop and deliver the dose. Radioactive source is inserted through a tube into a hollow lumen. Site is in this particular is esophagus. We can use this type of treatment in bronchus and biliary tract also. Why we use brachytherapy? This is very important questions. Uterine cervix is ideally suited for intracavity brachytherapy. Uterine cervix, where the hollow space is there, high tolerance of cervix, uterus and vagina. Cervix and uterus and vagina, its capacity to receive radiation is very high. So when we use brachytherapy, high radiations can be delivered directly to these organs. It is accessible organs, hence brachytherapy can be practiced with ease. The endocervical canal and vaginal vault form a suitable vehicle to carry rigid applicator with radioactive sources. These applicators can be used with minor modification in all points. In the case of CS cervix, nowadays very thin applicators are used and which can be fixed in the cavity very conveniently, and the very small sources of the size of approximately 3 mm to 6 mm are used in this case and can be traveled very conveniently in the applicators, and treatment is very convenient nowadays. This is a figure of different staging which shows the different staging of CS cervix. It is used for treating female gynecological malignancies by inserting radioactive sources inside a predefined applicator with a spatial geometry. Various lesions in sites such as cervix, endometrium, vagina, maxilla and nasopharynx can be used. Spread of disease. Growth originates in cervix region, spreads to tissues, vaginal vault, body of uterus, parametrium and to bladder and rectum. Lymphatic spread to nodes in the parametrium, pelvic walls and higher up into the abdomens. There are various stages of cancer, in particular CS cervix case. Stage 1, where growth is strictly confined to cervix. Stage 2, a little spread has occurred to the vaginal vault or the body of uterus or the parametrium. Stage 3, the spread has reached as far as the wall of the pelvic or the lower end of the vagina. Stage 4, the growth has invaded the bladder anteriorly or rectum posteriorly or has spread outside the pelvic region. In stage 1 and stage 2, the brachytherapy is a very useful tool to treat the case, while in stage 3rd and 4th, where the disease is spread to a distant points, the chances of recurrence is more, and in that case primarily teletherapy is used and doses are delivered in a larger area and then brachytherapy is used. This figure is showing the various stages of CS cervix. We can see in the figure 1 where the disease is confined to the cervix only. It is not visible by naked eyes. We can see with the help of microscope only. This is stage 1A. Then stage 1A1, no deeper than 3 mm or lateral than 7 mm. This is the size of the tumor. In first A2, 3 to 5 mm deep and lateral up to 7 mm. 1B visible or bigger than 1A2. Now in this particular stage, visibly disease can be seen, and in this it is further divided into 1B1 up to 4 centimeter, 1B2 bigger than 4 centimeter. In the second stage of CS cervix, beyond the cervix, disease is extended to beyond cervix. Second A stage onto the upper vagina, second A1 up to 4 centimeter, second A2 over 4 centimeter, and second B parametrial invasion takes place. Now next stage of the cervix cancer is third A, which is higher stage, where growth of the tumor is in lower 1/3 of the vagina. In stage third B, side walls and nodes are positive. Fourth A stage is the case when tumor extends up to bladder or rectum, and fourth B is distant metastasis takes place in this case. This again shows the different stages of the cervix cancer. Growth confined in cervix in first case. Second case, growth is in fornix and parameters are involved. Third stage, growth is spread to pelvic walls. And fourth stage, where anterior wall of the rectum is affected. If we see the different stages of the cancer in CS cervix case, we'll find that most of the time growth extension is in the lateral direction. So the initial treatment of the CS cervix is, there are two components. One is central growth, when growth is confined, growth in the cervix, which is best treated by brachytherapy. And in the second stage, or in the advanced stage, that is peripheral part, growth in parametrium and lymph nodes metastasis, which is best controlled by teletherapy. So if I sum up this thing, the CS cervix is better treated with teletherapy initially first, and then second is brachytherapy. Most of the CS cervix case reported in India are stage second B, third and fourth stage cases, where initially radiotherapy is given, and then after that brachytherapy is used, and we found that results are quite encouraging. Now, while treating the cervix cases, there are few points which we have to look after, or which we have to take care of. There are 2 points, point A and point B. They are theoretically defined and practically also understandable by. Point A is anatomical point position of the point A is chosen in the paracervical region. Anatomical position chosen in the paracervical tissues 2 centimeter lateral to the central canal of the uterus and 2 centimeter above the vaginal vault. Anatomically, point A lies in the region where the uterine artery crosses the ureter. In fact, point A lies on the apex of the triangle formed by the uterine canal, uterine artery and ureter, called the paracervical triangle. The point A, in case of the cancer, dose to the tumor is delivered keeping in mind that the tolerance of the surrounding normal tissues. Dose to the tumor is decided by the capacity or the capacity of the surrounding tumors. Significance here of point A is, this region is important in respect of tissue tolerance and is often the site of early infiltration and hence not to be under doses. Point A is the point where dose is prescribed and point B is the point where dose is monitored, and the anatomical position of point B is 3 cm lateral to point A. In an average patient, point B lies close to or on the pelvic wall, because pelvic wall is again a sensitive organ where high dose should not be delivered. So we monitor point B while treating the CA cervix case. The significance of this is given an indication of the fall off of dose in the pelvic region. The dose rate at point B is very useful for supplementary external beam irradiation. This shows the figure of cervix where the applicators are applied. Point A is shown from 2 cm above and 2 cm lateral from the external os. This is the picture of cervix applicators in one box where avoids and central tandem are placed, and in right hand side the applicators are applied to the body, and that figure is shown. Every part, every point is mentioned in the figure. Material of the tube is either rubber, plastic or stainless steel. Central canal, one end is closed and another end is with flange. 3 different lengths which goes to central canal. It can be seen on the radiograph, while avoid, which rests in the vagina, the material is rubber, plastic or stainless steel. Avoid tissue equivalent material, one end is closed. 3 different diameters of avoids are used: 2 cm, 2.5 cm and 3 cm. This depends upon the size of the vagina. If vagina area is big, then bigger size avoids are used. If it is small, then small avoids are used. And if it is further small, then even half avoids are also used in some cases. Tube can be seen on the radiograph. Avoids cannot be seen on the radiograph because the material of avoid is tissue equivalent, and when we take radiograph, the kV of the X-ray tube is high enough which pass through this material, and we cannot see the image of avoids in the actual radiograph. In recent HDR machines where cobalt-60 source is used, because of the safety purpose, there are certain laser welding is required while making the cobalt source to protect the source from the deterioration and damage. The stainless steel material is used in the applicator, and universal plastic tubes are used in these applicators, and the source moves in the universal plastic applicator. Iridium-192 source is also used, which is of short half-life. Is used this iridium-190 source, because of the less half-life, is frequently required change, and because it is frequently required change in approximately 5 to 6 months, the universal plastic tube is not required in those type of machines. We can see the image of one planning of CA cervix where 2 orthogonal X-rays with the help of C-arms are taken. We can see the applicators, stainless steel applicators seen in the radiograph. A bladder is also visible. A radio opaque dye is introduced in the bladder, which makes the bladder visible, and also a radio-opaque dye is placed in the vagina. A piece of gauze is placed at the bottom of the vagina, which gives the idea of the rectum, and the planning is done. Applicators from the applicator library are taken and superimposed in the image, and then planning is done. We can see that planning in this photographs. Now, another type of brachytherapy is surface mold brachytherapy, where tumor is either on the skin surface, just below the skin surface, or little at little depth, like in the sides are skin, superficial tumors, oral tumors, etc. Radiation is delivered by arranging radioactive sources over the surface of the tumor. Here, these applicators, either hard plastic or stainless steel sometimes, are placed in the area and mold is prepared. The distance between these applicators is approximately 8 to 10 mm, and number of applicator depends on the size of the area. If size is small, even 2 or 3 applicators is sufficient. If it is big, then more number of applicators are put and a mold is prepared, which is placed on the area of interest. Now, surface arrangement in molds, depending upon the area, different type of tumor, place of the tumor, the arrangement of the sources are shown in the figure, where either circular type of fields or the rectangular type of field is used, and different level of source arrangement is also shown in this figure. In one side, on the other side, it is a linear and cylindrical type of source arrangement is also there. Now, in curved surface, this picture shows how mold is prepared when the surface is curved. In actual sense, flat surface is not there. Most of the places surfaces are little bit curved, and this shows the arrangement of the sources. In curved surface, the activity to be used should be determined for the area treated. If the area is big, the total activity used is a little more. Spread over large area corresponding to application. The area for purpose of doses is the area of the applicator regardless of the area to be treated. This figure shows the interstitial brachytherapy, where the interstitial applicators are inserted in the body, and CT scan is taken. With the help of CT scan and software program, the planning is done, and this type of application is mostly done in soft tissues. We can see this is the case of CA breast, and applicators, number of applicators which are in the form of hard plastic are inserted in that affected area. Sources are directly implanted into tissues in and around the malignant growth. Generally, sites are breast, oral cavity, etc. The sources are placed into it, and accordingly the planning is done. Classification of interstitial implant. One is planar implant, when tumor spread is under the skin surface, when lesion can be sandwiched between the parallel planes of implant. And the second type is volume implant, when lesion to be treated is more than 2.5 cm thick. Plain implant leads to low dose region midway between the planes. Shape is sphere, cube and cylindrical type of shapes are possible. This figure shows after loading techniques. The applicators are inserted or implant at the respective places, and then images are taken, either orthogonal images or most of the time CT images are taken, and sources are loaded according to that after planning the case. Also, ophthalmic plaque therapy is used in brachytherapy for eye cancer treatment. Common tumors are choroidal melanoma, mostly occurs in adults, and retinoblastoma mostly occurs in children. Plaques are generally of two types. Sources are permanently loaded, and second case when sealed sources are temporarily inserted. Beta ray applicators are useful in treating lesions to a depth of few mm. The permanent radioactive sources which are used in these cases are low activity sources are there, which are permanently implant, and with time they deliver dose and decay also. So those can be placed permanently. But in second case, where the doses are little high, these type of applicators are placed for a temporary period and they can be removed after some time. Endovascular brachytherapy for the management of obstruction or blockage in the blood carrying arteries. The modes is bypass surgery, PTCA with stent. Drawback of bypass surgery is patient trauma. More failure cases are seen. Coronary arteries related with hearts, peripheral arteries other than heart, EV, IV brachytherapy are used, where prevention from the re-stenosis are achieved. Re-stenosis is the re-blockage of the arteries. This figure shows the room diagram of brachytherapy. We can see here the indirect entry into the room, and the wall thickness is more because of the activity of the source. The gamma energy is used in this case. For gamma radiations, high density concrete walls are used, which can be seen here. The whole room is made up of, whole walls are made up of concretes of high density. Mostly iridium-192 and cobalt-60 sources are used in high dose rate machines. Earlier, in low dose rate, cesium-137 sources were used, which are now most of the cases, most of the centers are now have discarded the low dose machines. Now mostly high dose rate brachytherapy machines are used. Now summary of this lecture is high dose rate brachytherapy, much improved treatment techniques. The size of the source is very small, 3 to 5 mm actual size. It can be used in most of the locations because of the small size. This high dose rate brachytherapy are useful for most type of cancers. The less side effect, because we are placing the radioactive source very close to the tumor, the side effect, radiation effects due to radiation is very less, and the mostly dose is delivered to the tumor. But if planning is not proper, it can be reverse also. There will be more side effects. So one has to be very careful. The physics part is very important in this to plan the case. In combination with teletherapy, it has been observed that better cure rate can be achieved by using teletherapy and brachytherapy. Treatment on outdoor basis. Because of the high dose rate, treatment time is very less. Patient can come and can be treated on the same day and can be relieved from the ward on the same day. So on the outdoor basis, patient can be treated. New sources are in use in brachytherapy. Mostly cobalt-60 and iridium-192 sources are very popular in this field nowadays. Better technology has emerged, so better cure rate is achieved. Advantage is over the teletherapy is because we are placing the source close to the tumor, so high dose can be delivered to the tumor. Next. Thank you very much.